Well, welcome back to WTOL 11 Your Day. In Lessons 101 today, we're looking at your child's learning and development. Dr. Jessica Tzou is with McLaren St. Luke's Family Medicine Residency Program. Good morning, and we're going to talk a little bit about ADHD today, right? So I was wondering if you could tell us a little bit about how this may be affecting a child's education, and especially parents who don't know about this. What can you tell them as they navigate this process?
Absolutely. So ADHD is pretty common. It's seen in up to 1 in 12 children, and it's a group of behaviors, usually first diagnosed in childhood and often lasting into adulthood. We have certainly heard of ADHD in a lot of popular media and so on, but in general, people who have ADHD have difficulty organizing things, listening to instructions, remembering details, may have difficulty controlling their behavior. So basically, even when they try to concentrate, they find it hard to pay attention. And children who have ADHD may be more sort of hyperactive or impulsive than is typical for their age. And then specifically, these behaviors lead to problems in multiple settings, so in school, at home, at work, and it causes problems in friendships, in learning, behavior. Home may be difficult, schoolwork may be affected. So it's normal for children to have difficulty focusing and behaving at one time or another. But children with ADHD are sort of beyond the norm, and they don't just grow out of these behaviors. So I know up on the screen you have a few signs and symptoms of ADHD. And keep in mind that it's not just, the kid who's running around all crazy at home, but is doing fine at work. So there's a whole list of symptoms in which children or adults will have difficulty with 6 or more of these over a period of time of over 6 months. So they can have difficulty following instructions or appearing not to listen. They can't or don't pay close attention to details. They seem disorganized. They're easily distracted. They can be hyperactive, fidgety, forgetting things, blurting out answers, interrupting people, can't stand the seat, have trouble waiting for their turn.
So Dr. Tzou, I'm wondering, you're mentioning a lot of signs and symptoms. At what point does this become an issue that you bring up with your child's doctor? When do you say, hey, this is something we need to take a look at?
Yeah, absolutely. If you have concerns, feel free to bring it up to your doctor. Keep in mind that diagnosis it's several steps, and there's no one single test. And many other problems like anxiety, depression, sleep issues, certain learning disabilities can present similarly. So also be patient with that process. But a doc will be able to sort of talk to you and maybe give you some forms or checklists for you to fill out, your teachers to fill out, or your child's teacher to fill out. And they may refer you to a specialist, they may not, but it's sort of getting input from multiple sources, different people, and sort of figuring out, hey, is this a problem we can help with?
Before we have to go, I'm also wondering, what does it look like with this treatment process? What would ADHD treatment consist of?
Absolutely. So first and foremost, although a lot of us don't think of it first, is behavioral therapy. So it's not just, helping the kid do better in school. That can include like organizational skills training or peer interventions that can focus on behavior. But it's also parent training, which gives parents the skills and strategies to help their child. It may look like individual learning plans in school. And then also, after 6 years of age, we can also talk about medications. Most of us have heard of stimulants like Adderall, but that's not the only type of class of medication. There are non-stimulants as well. But strangely, in ADHD, most kids who are treated with stimulants actually find it calming. So
kind of helps
there's certainly
reset
hope
the
out
brain.
there.
a little, or
Yeah.
calm a little bit. Yeah.
Yeah, sort of sort the brain out a little bit.
Well, doctor, thank you so much for giving us your time this morning and explaining some things to look out for. I know especially as parents think about education in the new year, some of them may be thinking, hey, this is something I want to take note of and maybe explore in 2022.
Absolutely.
So thank you very
Talk
much.
to your doctor, talk to your pediatrician if you have concerns.
Have a great rest of your day.